If you take the state CNA skills exam after January 1st, 2017, there are some changes you need to be aware of. The first one is that when you're taking a temperature, an oral temperature, you need to wear gloves or don gloves, D-O-N. For pressure ulcer prevention, we've already taught this, but you can put a pillow under the arm to cushion the elbow or a pillow between the legs to prevent skin-to-skin contact. But that's not a change from anything we've told you before. For the Foley catheter, it's going to involve positioning the tubing and catheter care, which is to empty the catheter when it's half full, and to clean the catheter whenever you do peri-care 5 inches down the tubing with a wet wipe. For occupied draw sheet, they want you to wear gloves. For measuring and recording urine output, they want you to wear gloves and remember to put it at eye level. They've taken range of motion off of the skills test and put emptying the down drain bag back on the skills test. Positioning, they want you to count to 3 when you lift the person up in bed with the draw sheet when 2 people are lifting, so you go 1, 2, 3, lift. They've taken off wheelchair and Sims positions. They've changed the word dangle at the side of the bed to sit the resident up at the side of the bed and allow them to adjust to an upright position. When you are feeding someone, you need to make sure that you offer a clothing protector and allow the patient or the resident to choose the foods as they are able. And we've eliminated verbalization of feeding complications. For denture care, they have added remove all adhesive from the dentures, always store the dentures in water, and rinse the dentures before reinserting into resident's mouth. You still need to wear gloves for dentures, and you still need to have a lined sink or water in the sink when you're doing dentures, cleaning dentures. There's no change to the log roll with the hip fracture. For oral care for an unconscious resident, you need to wear gloves, use the wet sponge, and roll out or remove excess fluid from the sponge before you put it in their mouth so they don't aspirate. Back rub, you can use lotion if the resident desires. And for foot and toenail care, wear gloves, and they don't want you to soak the feet, just wash the feet with warm water. Shaving, wear gloves. Perineal care, wear gloves. Place a waterproof pad under the resident. They've quit using washcloths and are just using the no-rinse perineal wipes. And apply a moisturizer or barrier as directed. With a bedpan, wear gloves. So now we're going to have a couple videos of some of the bigger changes.
Okay, we are going to change a brief and do peri-care on the female patient. So you want to have all of your supplies. I have my wipes, I have my gloves, I have my waterproof pad, I have my new brief. So I'm going to make sure that the pad is underneath our patient, and then I'm going to put my gloves on, and I'll have my wipes right here by me and my new brief. And first thing you want to do is undo the tabs on your brief, and then you want to make sure that the thumb goes on the thumb when you're putting on your glove. So I'm going to go ahead, I've got my pad underneath my patient, I'm going to go ahead and undo my ties, and I'm going to roll the front of the brief down, and we want to be very careful not to spill anything here. So initially I'm going to go ahead, I'm going to take a wipe, and I'm going to wipe the inner labia first. Always wipe front to back on our women, and then you're going to use a new part of the wipe the outer labia on both sides, and then the wipe goes right into the garbage can. I'm also going to wipe the upper thighs. Then I'm going to turn my patient on her side, and we're going to be rolling the brief in. I'm going to roll her on her side. Over you go. And I am going to clean her anal area front to back. And make sure you get everything off of her bottom using a new part of the wipe. And then you'll notice there's a little poop in here, so we want to make sure we don't spill it. So we're going to be wiping the brief. So when you pull the brief, be very, very careful not to spill anything. It'll go right into the wastebasket. And then putting the new brief on, we're going to roll her onto her side and just kind of tuck it underneath and make sure it fits. It's going to go around her, and then I can just reach under her and bring out the brief, and then we'll just bring it up between her legs, and the tabs are always at the top, and you'll just do up the tabs on both sides, and she is done. All clean. Okay. The other thing you'll need to do is take out the dirty brief. So you're going to take the liner out of the garbage can. You're going to take it into the dirty utility room so the room doesn't stink. Okay.
I am going to do catheter care and cleaning. So we don gloves. We make sure that the patient is covered up, the curtain's pulled, she's in the lithotomy position, and we use wipes, and we make sure that the catheter is taped to the inner thigh, and we hold the catheter at the urethra, and we wipe down 5 inches using a towel or whatever the facilities recommends. We would not ever use alcohol because that would be really painful. So I wipe it again, and we do that whenever we do peri-care. So after I have cleaned the catheter, then I want to make sure that the patient is comfortable, that the tubing goes over the leg, not under the leg, that there's no kinks in the tubing, that the catheter bag is attached to the bed frame and not the side rail, and the catheter bag is emptied whenever it's 50% full or whatever your facility's policy is. And that is how we do catheter care.